Hello, everyone, and welcome to today's webinar, Analyzing Trends Around Mental Health, Race, and COVID-19. For those of you who are returning Candid webinar participants, a warm welcome back. And to those of you who are here for the first time, I'm so glad that you've decided to join us today. My name is Elizabeth Cebada, but today's webinar will be moderated by my colleague, Asia Hadley, who's our Director of Partnerships in the Southeast. And I will also have my colleague Catalina Spinel helping me support this webinar behind the scenes. We'll be supporting by launching a couple polls as well as answering any questions that you ask along the way and posing a few of those during the Q&A as time permits. We do want to let you know a little bit about Candid for those of you who are joining us for the first time. We wanted to share that last year GuideStar and Foundation Center came together to form Candid, and together we have over 80 years of experience in the nonprofit sector. Every year, millions of nonprofits spend trillions of dollars around the world. Candid finds out where that money comes from, where it goes, and why it matters. We believe that an effective social sector is critical for a thriving society, and we believe in the importance of solutions for the sector, by the sector. Through research, collaboration, and training, Candid connects people who want to change the world with the resources that they need to do it. We also want to take a moment to say thank you for being part of Candid's learning community. We recognize that this may be a challenging time for many of you. Candid has shifted its key learning opportunities to virtual format, and you can learn more about them and trainings like this through the link that's on the screen, and we'll be sharing these in the chat in a moment as well. We've also invested in providing social sector with the resources they need to make informed decisions about today's most pressing issues, including COVID-19 and racial equity resources. And you, of course, can follow along with any of the resources that we are putting out to the nonprofit sector community through our grants-based newsletter. And again, we'll be providing all these links in the chat. Before we get started with today's conversation, we want to know what brings you to today's webinar. So we're going to launch a quick poll in just a moment. You should see it come on your screen so you can participate. And this poll is going to be a select all that apply question here. And really, we just want to know if your nonprofit is focusing on mental health, and that's really what drew you to this conversation, or if your organization is trying to cultivate mental health with those that you serve, or perhaps you're really focusing on your own internal staff and employees. And of course, there's also the option that you really just want to learn more about this general topic. And if none of these apply, we definitely want to know that as well, and we invite you to let us know through the chat. So Catalina, I'm going to invite you to launch that poll for us for our audience here. So we'll leave the poll open for another few moments. It looks like I have about 10% of the audience participating thus far. So I'll give everyone another moment or so to make their selections. And again, this is a select all that apply. And once you make your selection, if you can just click that submit button at the bottom of the screen, and we can register your answers that way. Excellent. We're approaching 60% participation, so we'll go ahead and we'll close the poll and share the results so we all know who's part of today's conversation. All right, well, thank you, everyone. We registered 74% participation, so that's wonderful to see. We have about 55% of the room just wanting to learn more about this general topic, which is amazing to see. And it also looks like we have quite a strong representation from folks who want to cultivate mental health with those they serve as well as their staff. So 40% and 25% respectively. And of course, there's definitely a strong representation, about a third of the room, of nonprofits that are focusing on mental health as part of their work. So with that, we'll go ahead and hide those results so we can continue with today's presentation and our conversation. All right, Asia, the floor is yours.
Okay, thank you so much, Elizabeth. We will have a conversation today with three distinguished panelists. Before I introduce them, I'd like to share that this is a conversation that will address four primary questions. How can nonprofit sector leaders address mental health issues from the individual, institutional, and sector levels? How can organizations prepare in the mid and short term to address mental health issues? What can the philanthropic sector do better to support mental health? And is there an intersection between race and mental health? While we'll focus on those main 4 questions, if we have time, we will also answer additional questions that came in um, throughout the registration process. And again, if we have additional time, we will also answer questions that come in through the chat. But as Elizabeth stated earlier, she and Catalina will be monitoring the chat so to make sure that your questions are answered. So without further ado, I'll go ahead and introduce our panelists for today. Dr. Amy Ubesi is a recent Penn State College of Medicine graduate where she received her doctorate of public health degree in community and behavioral health. Her doctoral thesis focused on mental health among African American college students. Prior to receiving her doctorate, she worked in healthcare management and operations for over 9 years. Currently, Dr. Ubesi is also a health consultant at a consulting firm in Washington, D.C. Next, we have Laura Sanchez Parkinson. Laura is the Director for Partnerships, Programs, and Research at the Steve Fund, a nonprofit organization that promotes the mental health and well-being of young people of color. At the Steve Fund, she works closely with nonprofits, high schools, and college campuses across the nation to support and transform educational structures for youth of color to thrive. Laura earned a master's in higher education and a bachelor's in organizational studies and sociology from the University of Michigan. Next, we have Eric McGriff. He is the Prevention Program Coordinator at the Crime Victims Treatment Center, an organization that offers free services to help individuals and communities prevent, respond to, and heal from violence. As a preventionist, he works with communities to create comprehensive approaches to reduce the likelihood of harm occurring, while also strengthening communities' ability to respond when harm does occur. He has been involved in this work since he was 15 years old and now works with communities to help create healthier environments that are better equipped to prevent and respond to harm. So I would like to thank and welcome all of our panelists. Thank you so much for joining us today. So we'll go ahead and ask our first question, and we'll just open it up to the panel. Anyone can answer the question and jump in as this is a conversation. How can nonprofit sector leaders address mental health issues from the individual, institutional, and sector levels? And let's start off with addressing the individual. I believe that we start from within and everything spreads without. So let's take it from that perspective first. Let's talk about the individual level.
Hi, everyone. This is Laura Sanchez Parkinson. Very excited to join you all in this conversation and such a timely discussion that we're having today. It's interesting that you mentioned starting at the individual level, because as I was thinking about this response, we all know that we exist in an ecosystem where we take into account how global national issues impact us as people. And so as I think about the individual level, I quickly have to sort of step back and say, okay, how is the individual impacted by what is happening in our world, what is happening in our nation, within our organizations? And we know that we've all been impacted by COVID, and experts have already begun to notice as well as predict the mental health crisis that our communities are facing and will be facing. We also know that it has disproportionately affected communities of color. They, at the individual level, especially for young people, their education has been disrupted. Within families, unemployment, financial insecurity, disparities in healthcare access and services. And so at the individual level, if we're all being impacted from what is happening across the globe, and really impacting the way that it's our well-being and our emotional well-being. What I think that the pandemic has highlighted, if we put it into that context, is the way that institutions have been created. So this is not something new, but the way that individuals have been impacted from, years and years of oppression, especially as we think about the recent killings of Black people and the following efforts to address racial inequalities. And so, again, I think that there are thinking about what's happening at the sort of social and institutional level, and then pulling in that historical component and how it has impacted our generations that then lead to the individual impact in the ways that we now need to address mental health through that lens.
Laura, with the work that you do, with COVID, everyone is basically, at home with your work with schools, so how has this impacted your work?
The Steve Fund is somewhat new nonprofit organizations. We've been around since 2014, and this has been work that we've been doing before the pandemic, and it has been critical. But I think that what we have seen post or during and post some of the impact that our society has seen, especially within the educational system, is that it has affected the way that social isolation has affected individuals. Also, in the ways that the financial crisis has hit our nation, and the ways as a result of COVID, and also in terms of the ways that we have now become more and more aware of the inequalities that continue to impact communities of color. One of the recent conversations we were having within our organization is that there was this conversation about the new normal. And to many communities of color, this has been something living in food deserts, even with housing and financial insecurity, has already been there. And so in some ways, how can we continue to learn about what the experiences of our different communities and the different people that we serve, and the ways that we can better support them. In terms of our work directly, we had seen an increase in thinking about how to weave in and integrate and make sure that the mental health and well-being of both within an organization, but also across sectors is being addressed. So even if you're not a mental health expert, how can you lean on, draw from research and data that's being out there in order to support your programming and your services?
Thank you for that. Now, Amy, I know that you recently completed your, doctoral research. Can you share just a little bit about that, particularly as it relates to individuals and African Americans?
Sure. Good afternoon, everyone. My research that I recently did was focusing on African American college students and their help-seeking intentions, particularly around students who reported being diagnosed with depression by a health professional. And what that research did was to explore the effect of positive mental health and what that has on help-seeking intentions of this population. And what we kind of found out from that is that women actually do, and this is across the board, it's not just in particularly in African American students, but that women actually report greater help-seeking intentions than men. We've also found that positive mental health does actually have an association with the number of sources that a depressed student seeks. So, the higher positive mental health the student reports, the more likely they're going to seek multiple avenues of help. And the types of help that these students seek actually is more intimate, where they're seeking help from either their family member, a significant other, a friend, in some cases a religious counselor, and that students who actually have who are reported being in a relationship actually had sought more more care, more help from outside sources. And so with all of that kind of combined, what you can kind of gain from that research is that it's mental health and help seeking intentions it's very nuanced, but it's also very intimate and close to the individual. So when we're looking at organizations or institutions, and in this case it's academic institutions, when we're thinking about how do we address mental health, how do we provide resources to this type of community or other communities, you have to kind of look at what is the behavior pattern. And if students are seeking help from their friends or their partners, is it so much that we put all resources in just on on-campus counseling, which is a very valid and useful resource. Counselors are phenomenal. But there's also additional resources. Not everybody is going to seek help in that way. And if we're going to look at it from a population perspective and really providing adequate and quality care, we need to kind of survey and poll the individuals that we have, that is our audience, that is our population, and provide targeted care for them. And perhaps it looks like programming that looks at social networking or interpersonal relationships. Those types of programs and investments, particularly in this age group and particularly in communities of color and particularly with African Americans, the research is showing that actually is beneficial and can work. So that's kind of a whole gamut there, but maybe that answered a lot of the questions.
Yes, yes. And I also know that Eric works within communities, trying to make them healthier, working with violence prevention. And we know that, home is not safe for everyone. And it's important for us to realize that people are, many people are out there are really struggling. Parents are struggling, having kids home, or they are, educating kids while they're not in school. Um, People who may have been in abusive relationships, now they're stuck, at home together. So we've seen an increase in violence against, women and children. So Eric, can you speak to, how the nonprofit sector can help, in these type of circumstances on an institutional level?
Yeah, thank you for that. So for me as a preventionist, one of the things that I strive to do is stay true to my beginning in this work, which was in domestic and sexual violence prevention. And so when it comes to my implementation and like research methods that I'm using in the communities that I'm working with, I want to use a methodology that really complements that kind of work, right? What would we do if we were with a survivor, right? We give them options, we give them choice. We exercise humble inquiry, right? If you want to know what folks need, you ask them, right? And you try to find ways to get to them, using all the platforms that you have. And so I think when it comes to an institutional level, it would be really helpful to exercise more humble inquiry, right? Lean into that curiosity and interest in the folks that you're working with. Use more participatory process, right? Actively include them. Don't just ask them, right? Because when it comes to business as usual practices, right, the ways that we meet are like open dialogues, facilitated dialogues, presentations, status updates, brainstorms, and these are the main ways that we meet in our organizations and even in school. But one of the issues with those formats is when they become the norm, right? Those formats either centralize power around folks who get to decide if, when, and how others get to participate, or they lack enough structure to provide the psychological safety that folks need to come forward. So for me, workshop nerd, I'm always looking at the ways that folks choose to convene, the ways that they choose to personalize their relationships, so that they can create the psychological safety for folks to really open up and share a lot of the information that we're not capturing in traditional research and evaluation. And that information will help us move from, more machine models to a living systems model that is more reflective of who we are as, human beings.
Mm. You touched on several key areas there, but can you share just a little bit more about moving from, you said a systems level to a more humanistic level? What
Yeah,
was that? Yeah.
moving from a machine model, right, that
Mm-hmm.
really looks at people as like their roles and the
Mm-hmm.
numbers, and the more like I always get these quantitative uh, to measuring things like psychological safety, confidence,
Ah,
commitment, to recognizing the places where we might have to divert from
mhm,
evidence-based practices because it's not in line with the
mhm,
safety, culture, values of the community that we're working with, right? It's
mhm,
also recognizing the ways that, epistemic ethnocentrism is operating, especially now with the conversations of racial inequality, and really looking at the ways that sometimes, evidence-based mandates have the
mhm,
unintentional, maybe intentional effect
mhm,
of disappearing local level knowledge and culture and practices that can be just as effective, if not more effective, than the evidence-based results, because they have the trust, the confidence, again, that
mhm.
the inclusion of the community. So there's naturally going to be more things sometimes like buy-in and sustainability, right, and ownership.
Mm-hmm. Yes, and as we look at organizations, Candid is in touch with many or different types of organizations, and with COVID, we're all having to come up with creative ways to connect, creative ways to stay informed and be together. So this is definitely a change for us all. And one of the ways that we have seen organizations try to make sure that at least their employees are mentally well, they're having meditation classes, or just like a 30-minute or 15-minute meditation, water cooler chats, things that you would normally do in the office. You chat with your friends as you walk, past, or in the lunchroom. You Instead, we're having these conversations online as water cooler chats, and I'm sure that many of you on the line may have instituted these practices, but if not, these are great ways to help with mental health in your own organization. um, Between meditation and, meeting informally, happy hours, so maybe it's not an hour, maybe it's 30 minutes or 45 minutes toward the end of the workday or right after the workday via online. So these are all different, strategies and ways that, we're looking, at organizations on a sector level to help, with the mental health of employees and staff. All right, let's move on to our next question. Um, how can organizations prepare in the mid and short term to address mental health issues? And I know that, Laura, with the Steve Fund, there's a lot of work that's being done in this area. Can you share just a little bit about what organizations can do mid and short term to address mental health issues?
Yes, and I really liked what already the other panelists have mentioned. I love humble inquiry. I really like that
Mhm.
phrase. I'm going to take it from now, but really thinking about how are we learning from both the people who are experiencing, which is all our employees, the people that we're serving, asking them what is needed in order to meet the needs. We know as we think about students, for example, both primary, secondary, higher education, we know that the way that they left is going to be very different than the way that they come back in the fall. And even the platforms in which they re-engage might be different if it's only online or a hybrid or back on campus. And so I think that as we think about preparing organizations, one of them is understanding what is it that our audiences, our communities, and those that we serve need at this point. And I think drawing from research like Dr. Ubesi's that has done and that really sort of gets at, we know that research and data informs the way that we gather, the way that we structure our services, the way that we connect with others. And so drawing from those, while I also appreciated Eric's reminder that there is flaws in the ways that the research has been conducted in the past, and how can we continue to challenge that, and also in some ways elevate the research that has included communities of color or communities in which that we serve. And so I think as we draw, one of the things that the C Fund does, we have a network of experts and scholars who inform our work. And we draw from their expertise, we draw from their experiences in order to plan for what we have ahead. We're working currently with a number of higher ed institutions and nonprofits who are wanting to meet the needs of their students. We're building out, for example, workshops that are timely. Our staff are concerned about how do I re-engage students knowing that they've experienced all this trauma, both in terms of COVID, but as we all know, in terms of the most recent killings of Black people and injustices that are continuing to happen to undocumented folks, international folks. And so really, we're building out workshops to directly impact students. How can they process, heal, re-engage with their communities, whether it's an educational community or within programs that they already are involved with, in order to be able to heal from everything that's happening and understand, again, what is happening to them at the individual level, but also at the structural level. I think that this is an opportunity to continue to educate both young people, but also adults in terms of what is structural racism, how is it impacting our well-being and our mental health, and how is it impacting our communities?
Yes, I definitely am interested in hearing some recommendations. I know that you said that, your organization, you're conducting workshops or building out workshops to help students, particularly during this time. I'm interested in hearing some of the recommendations that you know, you're providing them, because we have people on the call who may be parents who have this could be relevant for family members. It could be relevant for the populations that they're serving. They may be working with youth or college students, but also it relates to us as individuals. We can also learn from that. So, Lauda, feel free to jump in. But I also know that Eric, you are also, working with communities and helping with, mental health at this time. What are some of the recommendations that, you're sharing uh, with your group and team and clients that you work with?
Yeah, thank you. Wow, this is such a powerhouse panel. I'm so happy to be here with you all. It's great to hear everything that you all have to say. So for me, a lot of what I'm doing is really talking to folks about what humble inquiry is. I'm talking to them about how it is really on a lot of leadership, in a sense, to create fertile ground, right? Create the conditions for the development of a healthy, personalized relationship, so that the folks that we're with can feel seen, especially the ones who are, disproportionately experiencing harm during this time, right? I'm asking them, in those conversations, how are you tracking their needs, and how are you being proactive, maybe to collect a list of community organizations that offer free services or services your insurance, right? And really, it's really like, moving based off, the input that you're getting from your communities. And what happens, right, when you have a personalized relationship, what happens when you include folks enough, and there really is this sense of psychological safety in the organization. There's, better bottom-up communication, right, folks? There's more buy-in, right? We can iterate, we can innovate, and we can evaluate faster because we have included everyone, because we've eliminated what we're working actively to eliminate this barrier that white supremacy culture puts up in our work environments in the form of professional distance that absolutely sometimes ignores the reasons why we shouldn't be treating everyone the same.
Mm-hmm. Mm-hmm. Yeah, I really like that, bottom up communication, making sure that we're tracking the needs of our staff, including our, the people that we're serving, making sure that everyone feels heard at this time. Does anyone want to add to this?
I'll mention, this is Laura again. I'll briefly mention that we do have a number of forthcoming publications and hopefully resources that will be useful to those in our audience that I'll be happy to share afterwards, and look out for them as they come out. We have the Steve Fund has a COVID task force, which is composed of folks from leaders from across sectors, higher education, corporate, nonprofits, and your question is exactly what they've been working on in the last month or so, and we'll be publishing a list or a report with the recommendations on what we can do to better support the mental health and well-being of young people.
Great, and we should have those resources in the link or our PowerPoint. Is that correct, Laura?
The report will be coming out
Oh.
in next month, August. But I did share a link. There's a link if you are interested in seeing who's part of the task force and their charge, as you can check out what to expect from the report.
Okay,
Yeah.
great.
We're adding those links to the chat right now, but they'll also be embedded in the PowerPoint PDF that everyone will be able to download in the follow-up email as well.
Thank you, Elizabeth. All right. Our next question, we're going to move on to the broader sector. What can the philanthropic sector do better to support mental health? So, we've talked about really the individual. We looked at institutional. Let's go even broader, because we have a responsibility in this sector to be as supportive as possible. Now, I wrote an article in May during Mental Health Month, and it really talked about the mental health crises that we're actually facing in this country, particularly exacerbated by COVID, and how important it is for the entire sector to participate. So when I was looking at some of the funding trends, I was really shocked to see really how little funding actually goes toward mental health, and how little funding right now, even in the midst of COVID, funds are being directed toward mental health. And I want to talk just a little bit about why that's so important. One of the things that came out in my research is that uh, the sector needs to have more really cross-sector collaborations. So meaning we need organizations from many sectors to work cooperatively to address, systems for health and well-being. So grant makers can support these collaborative efforts through funding, of course, and acting as a convener to discuss pertinent issues related to mental health care. Of course, fund more organizations that are dealing with mental health and providing these services. It's so important because a lot of funding comes from the government, but we know that cuts, some heavy cuts were made, and the sector is really there to help fill some of those gaps. But we know that those gaps have widened since COVID-19, particularly as it relates to communities of color. But it's important for the sector to come together to address some of these issues as well. Another one of the recommendations, I found was to increase general operating support for organizations providing community-based services. As many of you are nonprofit leaders, you know how important general operating support is. So we have found that currently private foundations fund less than 2% of total mental health funding in the US, less than 2%. That is, oh gosh, that hurts my heart. So we definitely want to see the sector increase their giving to include support for mental health, particularly during this critical time. We want to see investment in mental health funding in communities of color. And also, sometimes it's difficult to track this. Candid has a coronavirus pop-up page that we conduct research to track trends in funding. We have access to that. You have access to that funding pop-up page via the links in our chat and on our website. So those are just some of the a few things that I came across. Does our panelists want to share, just some recommendations and some of the trends that you're seeing in the sector to so that the philanthropic sector can do better to support mental health?
I guess I'll go ahead.
Mm-hmm. Go ahead.
And the other panelists may have more to say on the philanthropic sector. But some work that I've done in the past has been on a state agency level. And I know kind of what you were speaking to, Asia, when you talked about cross collaboration. And I know a lot of the models, or some of the models now in states that you're seeing, is that at least from a state agency perspective, that they're looking to collaborate, whether it's their departments of health or their departments of education, the labor industry, are really kind of coming together to try to figure out how to solution some of these really pressing public health issues, where they're kind of adopting this model of health in all policy. And that kind of funnels down to the community level, where they are trying to build capacity build, and are looking for community organizations to collaborate with to really address it on that structural level. I do know some of that is out there in certain states, certainly not all of them, but those are ways that I think organizations can start to look at, openings and ways to kind of address these needs, like mental health, which touches many areas of the social determinants of health, whether it's your socioeconomic status, access to healthcare. We haven't really talked a lot about that just yet, and some of these other barriers to getting care, sustaining your care and coming out a better, having better health outcomes. So I think those are ways that additional ways, not that philanthropic organizations aren't already doing that, but to try to invest in those types of efforts.
Absolutely. And I appreciate that you talked about how mental health touches so many different other parts of our lives. So for example, mental health as it intersects with the criminal justice system. We know that I know that the stat is over like half of the people that are incarcerated have some type of mental health illness or issues. And that is that's critical. And then particularly with the stress and mental health issues as it relates to COVID, it really puts us, the entire society, because when you have one community that's in distress, it affects the whole. So we're looking at how mental health it touches on so many different issue areas that are very complex that we're trying to tackle basically all at once, so many different facets of our community are doing that. But we know that, with time and data, we've become aware that, the pandemic is killing disproportionate share of people of color across the United States. And um, and this, systemic and structural inequality, it just adds to, um, just the burden of just coping with everyday life. And so when you add, mental health and substance use disorders to the mix, you have a recipe not only for increased risk of COVID, but also an increased risk for incarceration and homelessness. So therefore, as a sector, as a society, cross collaboration is going to be so important for us to, provide a safety net, to provide the help and healing that, our community so desperately needs. So we have our final question before we move on to some of the questions that were asked. Is there an intersection between race and mental health? And if so, what is that intersection? Laura, I'm going to ask that, I know that you take the lead on this one, because I know that you had some great insight into this.
Sure. And I was thinking about the last question that we were discussing, and I think that in some ways this last question feeds into that, in that we are at this point in time when I think there's an opportunity that, because of the disruption, because of the public discussions and awareness that as a nation we become more and more aware about the inequalities that our communities are facing, particularly around race inequalities. I think that there's an opportunity to continue to add to that education, as well as to address those inequalities. And so again, I'm excited to continue learning more about Dr. Vessey's research, because in some ways there's researchers like that and those in our network at the Steve Fund who have demonstrated the direct impact between experiences of racism connected to not only mental health concerns, but medical concerns and health. And so when we have the data and the research that shows us that, I think that it's we can't ignore that, and we have to do something about that. And even if our services and our programs and our work in other organizations may not focus around mental health, what are the ways that we can integrate it throughout? Because we know that if we are serving communities of color, they are facing racism and discrimination in this country. And as a result, they're also experiencing health inequalities across the board. And so, for example, we have recent research that was conducted from data collected from the Healthy Mind study that shows that they surveyed students soon after the closing of schools because of COVID, and data shows that Asian students, for example, were more likely to experience racial discrimination during the pandemic than any other race of students. And so what that shows is what are the unique experiences of Asian and Asian American students during this time? How are they being impacted, their well-being, their sense of belonging, not only in the education system they're experiencing, but in the nation? How are they feeling, and how that's impacting, especially now as they've become isolated? We know that Black, Latinx young people don't see administrators and faculty and teachers as sources of support. So how can we learn from those experiences and know that we need to be able to integrate supports and programs to better serve these students, but also to work with administrators and staff? And that's the work that we do at the Steve Fund as well. We work with educators throughout the high school and college and universities to think about the policies and practices that have traumatized students. And this is an opportunity to reassess what we have not been doing and make sure that when students come back in the fall or re-engage with us, that they're not being re-traumatized after everything that they've experienced.
Laura,
Yeah.
I'm just going to jump on the line real quick. Your microphone is coming in and out slightly, so I just want to let you know that But Aja, I'll let you continue with the conversation.
Okay, thank you, Elizabeth. Yes, so, we have many people on the call who want to know, just learn more about this topic and may be interested in learning, why are African Americans and people of color disproportionately impacted by COVID?
This is Amy again.
Yes.
I'll touch on it just a little bit.
Mhm,
I think Laura and Eric have definitely discussed it in the previous
mhm,
questions. But one of the big reasons why persons of color are
mhm,
disproportionately impacted is really, it's a historical. There's a historical piece to it. There's obviously the structural racism piece to it, and those are just, outside of COVID. It's already an issue. And then when, like
mhm,
you said earlier, when you add COVID, this pandemic that the world is really experiencing, it just
mhm,
exacerbates those things where communities that were not able to access health services initially, and were already burdened by chronic illnesses, whether it's
mhm,
diabetes or it's heart disease.
mhm,
Now you're living in this world of COVID-19 where the healthcare system is tapped. We don't
mhm,
really, we're seeing that our public health infrastructure isn't as strong as we thought it was, and it's trying to do
mhm,
the catch-up mode at the same time, in real time, trying to save lives from a day-to-day, you know, day-to-day perspective. And so when you add all those together, there's somewhere that's going to be impacted, and it's going to be the health system, and you're
mhm,
not going to get, as quick access to care. You may see delays in
mhm,
access to services. You may see, this is a stressful time for many, particularly
mhm,
health professionals who are trying the best that they can. You may see the ball dropped a little bit when it comes to caring for individuals because there's so many and you don't know where to go. And
mhm,
all of these things are just, again, exacerbating the issue of, disproportionately affecting our communities of color, our marginalized communities, our
mhm.
communities that have disabilities, all of that, and COVID is really something. This is kind of, for lack of a better word, the perfect storm for
Mhm.
and seeing that, we aren't as advanced or as on top of things from a health perspective as the world and certainly the United States thought.
Mhm. Yeah, I definitely, sense a fragility there, within our system, and COVID really exposed it. And hopefully, we can use this as an opportunity to strengthen our structures, make sure that more people have access, and expand new ways or less. Less used ways of accessing the healthcare system. Now, we knew that telehealth was, being used, but more people are using it now just because of the situation. So this can be hopefully something that can be incorporated into, the healthcare system more broadly, I should say. But then again, a lot of people who are experiencing, severe mental health issues, if you're talking about people who may be homeless or people who, may be in very, fragile situations, they may not have access to, even those newer ways in which we access healthcare now. So, Eric, is there something that you would like to add as it relates to race and COVID, the intersection of race and COVID?
Actually, no, I think Amy, Laura, and you, Asia, did a great job. I don't know what I could
Mhm.
add.
Just to add to that, I was just looking through my notes and found that there was a report by the Kaiser Family Foundation. You definitely can look it up. The Kaiser Family Foundation. There's a 2020 report that talked about how Blacks and people of color are being impacted by COVID, and a couple of reasons that we had not mentioned. Um, showed up. So for example, you have a lot of African Americans and people of color who are often working in jobs that are not amenable to teleworking. You know, they use public transportation that puts them at risk for exposure to COVID. You have individuals that may be living in housing situations that are multi-generational. We saw that that was the same issue that Italy had. They have multi-generational families. That's why it spread so quickly. And the same in communities of color, you often have multi-generational families living together, or you know, a lot of people living in, you know, one house, uh, whether it be on public housing or where in places where it makes it difficult to social distance or to self-isolate. And then we have to think about how African Americans and people of color are more likely to work in the service industry, such as restaurants, retail, hospitality, where they have to, you know, they're essential workers, so they have to be out there, or they choose not to be, and then you know, suffer those consequences. You know, so it's really, you know, putting a lot of people between a rock and a hard place. And then, you know, I don't know about you all, but I have a 7-year-old daughter and a 9-year-old son. We just received news that their school is going virtual. The first thing that, you know, my husband and I thought about was, what about all of those parents that really need to go back to work? Or, you know, how are they going to do this without any type of, you know, choice and support? So, you know, we're grappling with lots of questions, you know, coming up with answers that hopefully are creative and are solution oriented, that may work for some, but not for others. So we're having these conversations within ourselves, with one another, and on panels like this for the broader community to think about how we, as an individual, as a community, as an organization, can positively impact the lives of those that we work with, those that we live with, those whom we serve. So it's 2:54, and I know that Elizabeth, we may have an additional question. We're going to get ready to wrap up. Is there a question in the chat, you know, that we could, you know, potentially address, Elizabeth?
Yes, we've had plenty of questions come in through
Yes.
the chat, and I wanted to flag the one that came in from Terry here. And Terry is, you know, sharing that, you know, African Americans over the years have been very secretive when it comes to seeking mental health, almost as if the issue is taboo. So how do you see breaking through these attitudes and helping youth and or adults who are in need of help during these times?
Yeah.
And we'll pose that to our panel.
Panel, yes.
If I could just add just one piece. One thing that, you know, happens sometimes with communities or cultures that are, you know, from, you know, marginalized, oppressed communities is that they will isolate as a form of self-protection, right? And so I just want to like acknowledge that, because that's something that we see here in New York. That's something we see here in New York City. You know, that could be something that does happen as a way to protect yourself.
Yes, thank you for that, Eric. Do we have time for one more question, Elizabeth?
Can I add a bit as well to that question?
Oh, okay, great.
Something that I was thinking about as I was reflecting on that question, and thank you for that, is that, you know, there's research, and I appreciated Dr. Bessie's research and findings around the nuance between seeking for help. Because I think that oftentimes it's easy to look at the numbers, to just look at the quantitative data and show and see that Black, Indigenous, people of color may not necessarily be seeking professional help. But I think that one angle that our organization takes, and I think in our work, is also thinking about the cultural wealth that our communities bring, and ways that that our communities find other ways, whether it's storytelling, whether it's, we know that they've endured so much trauma, and what has helped. And so I think also learning from those experiences is very useful. We know that particularly right now, it's the young people of color, the ones that are filling out unemployment applications, are the ones that are helping their parents get back on track. And so we know that there's resilience. We know that that many Black and Indigenous and people of color, while there might be the stigma, and that is something that we need to continue to work on, and part of it is because a lot of the profession has never represented their communities. And so again, I just wanted to highlight the cultural wealth that oftentimes is missed when we only see the numbers and the research around help seeking.
All right. Thank you so much. We're coming to a close. It's almost 3 o'clock. I want to take this opportunity to appreciate our panelists, Dr. Ubesi, Laura, and Eric. Thank you so much for taking time to be here today. I'm going to go ahead and close out and turn it over to back over to Elizabeth.
Yes, and I will definitely echo those thank yous to our panel and to everyone who joined today for this conversation. Thank you so much for taking time out of your day. Our entire panel, Amy, Laura, Eric, thank you so much for joining us. Asia, thank you for a great moderation of this session. And again, thank you everyone who's still on the line. If you have any additional questions, please feel free to reach out to us and our online librarians on candid.org. Thank you so much.